I'm Samantha Olds-Fry, CEO of the Illinois Association of Medicaid Health Plans, and this is Sam Says, a podcast series focused on Illinois Medicaid managed care.
Hello, I'm Durandal Beverly with the Gemini Group, and welcome to Sam Says. On today's episode, we sit down with Laura Minzer, President of the Illinois Life and Health Insurance Council, to discuss the healthcare coverage and importance of preventative care here in Illinois. But first, let me welcome our host, the Sam in Sam Says, Samantha Olds-Fry, CEO of I'm Hip. Sam, how are you today?
I am wonderful, Durandal. How are you?
I am doing well. As I stated earlier, we have a very exciting show today, and we're excited to dive into today's discussion on comprehensive healthcare coverage and preventative healthcare. Sam, can you outline the impact of commercial coverage on the Medicaid population and why here on Sam Says that we're talking about Medicaid and commercial coverage for preventative healthcare?
Absolutely. And while we sort of think of these as separate programs, right? Like Medicaid has separate policies. It's really funded separately. It's funded by the government. It's an entitlement program based off of income. And obviously with commercial insurance, it's either employer sponsored or self-purchased off the exchange or it's very separate and different. However, when we look at the healthcare ecosystem holistically, they're far more intertwined than we sort of like talk about or give credit to. And the foundation of that is all of us, whether you have commercial insurance or you have Medicaid, you're often going to the same providers, the same hospitals, the same doctors. A lot of the networks are very, very similar. And especially when you look at emergent care and pharmacy care, Walgreens, CVS, et cetera. So they're intertwined with regards to the providers, but also with regards to the members. When people think about Medicaid, they often incorrectly think that you are on Medicaid for an extended period of time. Like you're on Medicaid for years upon years upon years. And it's really not the case. If you are a senior or you are disabled, that is often the case for you, but that is a very small portion of our population within the Medicaid program and within the state of Illinois. What is far more likely is that you are either somebody who's eligible because of the Affordable Care Act, or you're eligible because of unique circumstances with your family where you've been laid off, temporarily, or you've had a dip in hours. And so you've lost income to afford private insurance, or you've lost your employer-sponsored coverage. And so you're on Medicaid for just a short period of time. And then you go back to the commercial space. And so when we think about it that way, what occurs in the commercial space is going to have an impact on Medicaid. And then what occurs in Medicaid space is going to have an impact on commercial insurance later down the road. And so there's this intertwined component that we just don't talk about a lot, which is why I'm so excited to have Laura on to talk about sort of that synergy and how there are certain areas where, even though our programs look really different, where we're incredibly aligned and have the same goals, and where we can sort of almost work together, because as we improve health literacy and education for the Medicaid members, it's going to have a positive impact for commercial and vice versa.
Laura, can you provide a holistic overview of how the ACA impacted private insurance and the focus on preventative healthcare coverage?
Sure. The ACA was drastically changed our health insurance coverage system, healthcare system generally. But when you think about pre-ACA, the very fact that individuals couldn't, if you had a pre-existing condition, you may not even be able to get a health insurance policy in the private market unless you got it through your employer. Or if you had a pre-existing condition, they were held to sort of a waiting period. It may have been exempted from your coverage. So it was kind of a patchwork approach. And really insurance, from a if you stand back and think about insurance generally, it's about protecting against loss and risk. And when you think about other types of products in the insurance space, they're designed, and health insurance pre-ACA was designed this way, which was to protect you against, unforeseen circumstances. So emergency room visits, catastrophic events. But that all changed with the ACA, and much more focus on not only your health insurance covering and accessible for individuals, regardless of pre-existing conditions and underlying medical conditions, but shifting it more towards a preventative a care type of coverage. You don't get that, obviously. So if you have, my auto insurance policy doesn't cover car maintenance, I wish it would, but it doesn't. And the reason for that is because in the healthcare system, it's very proven that burnout, managing one's health and the patient population with the chronic diseases that cost, it's the 80-20 rule. So 80% of our healthcare costs are borne out by 20% of those with, high cost conditions. And we want to prevent against those. So preventative care plays an important role in ensuring that we try to reduce that percentage a little bit, and certainly reduce the costs that are borne out across the entire system, Medicaid, private, Medicare. It all kind of has, as Sam was saying, not only intertwined from the patient impact, but also intertwined from the financing mechanisms as well. So with respect to, kind of what that looked like from the consumer perspective, what the important carrots for going to get your preventative services was that it wasn't any cost to you. And by that, I mean, you do have to pay the premium if you qualify for a tax credit or a cost sharing on the exchange. Certainly your costs may be minimal to nothing, but if I go to my doctor for an annual visit, for example, or take my baby for a well baby visit, that's all covered at $0. So we call that first dollar coverage of preventive services. So that concludes, obviously what I mentioned: primary care visits, vaccinations, immunizations, screenings, mammogram, colonoscopies, colorectal cancer, depression screening, if you have substance use disorders, some of the treatment services that come along with that, tobacco cessation. There's a list of services that are covered, and they're kind of consistently updated and dictated by the U.S. Preventative Services Task Force. And health plans do examine, even within their own population, what is an opportunity for taking away some of those costs and removing, quote unquote, barriers for individuals getting to those frontline services.
And Laura, that is so helpful of an overview. And I'm just sitting here thinking, you've outlined other ways in which Medicaid and commercial coverage have just become far more similar in certain respects, especially here in Illinois over the past, nearly 10 years since we've seen expanded ACA coverage, since we've seen a shift to Medicaid managed care, because also in the Medicaid space, all of those preventative healthcare coverage benefits, they're all also zero cost. So if you need your COVID vaccination, or you need to go for your annual physical, or you need to take your baby to your well child visit, that's all free as well for Medicaid members. And I think that just sort of reminding everybody from the member perspective that there is that zero cost at the doctor's office for those services, and that's, if you have health insurance, whether it's through Medicaid or whether it's through commercial, like that's simply the case, which is not really where we were a decade or 15 years ago.
No, not at all. Not at all.
And I also am thankful that you brought in the intertwined nature of the financial piece, because I think that from my perspective on the Medicaid side, it's so common that people don't appreciate how Medicaid or Medicare is going to impact their private insurance because they have private insurance. But at the end of the day, if we're all going to the same doctor or we're all going to the same hospital, if Medicaid or Medicare is underfunding the system, commercial insurance is picking up the bill and that's showing up in your premium. Or if Medicaid or Medicare, typically, honestly, in Illinois, previously it was Medicaid, is paying really slow. And we're and the Medicaid program is destabilizing the program, or the healthcare industry. That impacts all of us, not just those with Medicaid coverage. And so, from a public policy perspective, but just a reality perspective of going to see the doctor, going to the hospital, it's all in our best interest to have a strong Medicaid program. Even if we hope to never rely on it and hope to always have commercial insurance or Medicare, because the Medicaid policy will impact all of us.
For sure. You could spend an entire podcast just talking about the financing mechanisms and how they're interrelated beyond just preventive.
Yes, they are. Absolutely. And honestly, probably like 3 of them. But as we sort of dive in further and focus on preventative healthcare, and you listed out a good amount of stuff already, but let's just sort of level set. And what do we mean when we are talking about preventative healthcare? And I think most importantly, because I think some people have things always top of mind on preventative healthcare, but what are some of the areas that are overlooked, sort of from your perspective, about like what is included in that preventative care health bucket?
So I think from my perspective, there's definitely a huge emphasis on women's health services and children's health services. If you look at sort of that list, I mean, adults, generally falls in that, but I think some gaps in one glaring is for prostate PSA screening has long been discussed. As far as why is that not included? I know that's sort of a talking point in amongst particularly consumer advocate and patient advocate groups. But men's health, I think, is something that definitely needs a little more of a exposure within the preventive services, particularly because I'll just think about my husband and sort of men are not as open about their health issues or going to the doctor proactively, not putting them in generality. But I think it is important to kind of think about that in the context of preventive services and sort of putting more of an emphasis on there. That's obviously for discussion amongst the clinicians and the medical providers within the larger preventive services task force. But that is one area that I think is sort of a gap. But taking that a little of a step further, we talked about those screenings, for example. And so if I go for my annual mammogram, it's covered at 100%. But what if I'm called back for a follow-up or second look? Maybe then that's sort of what we refer to as, we code it as diagnostic. Same happens in the colonoscopy space. If they discover a polyp, if it's benign, it's removed, but it can be coded as diagnostic in your follow-up. So you have an expectation as a consumer, if you're well versed in this, that you go in for those and it's all covered at 100%, and suddenly you get a bill from your provider subject to your out-of-pocket costs, which many consumers these days have what we call high deductible health plans. So there's sort of 2 sets of costs. There's the premium you pay to have the policy, and then what costs are accrued after you start using that policy. And that can be a little bit of a sticker shock and sometimes a deterrent for those in their follow-up if they're concerned that maybe it was just a one-time deal. I know in Illinois, particularly this last year, in the last several years, there's been lots of discussions at the state legislative and the policy arena about how do we fix that hole or that gap. It sounds much easier than it is to do because the way, and again, this would be an entire podcast of how insurance is regulated, but the majority of policies are not regulated by the state of Illinois. They are employer plans where employers design their benefits. They're essentially the relationship with the insurer is for them to manage the back office type of administrative work. And I can talk more kind of about the role that employers do play in partnership with their insurers to kind of reinforce the preventive services side. But I think those are definitely gaps in sort of the overall ability to get somebody into preventive services. And if we talk preventive, it's sort of the front door, right? What about if I have a chronic condition, I'm diabetic, or you have certain comorbidities that go along with that? You as a patient and a provider and your health insurance plan have to continue to manage that cost. So there's the costs that are borne out if I'm, recognized as high risk. Preventive is also about maintenance and managing your conditions appropriately, but that can also come with challenges because there are costs involved with that. Maybe you're on a prescription drug that's a little difficult for you to cover with your out-of-pocket. Again, what I talked about, the high deductible out-of-pocket costs. We're at least in a world today where those are now capped annually. So you can only pay so much out of pocket, but for those on a fixed or limited income, it's still, it's not insignificant dollars. But I also think back to pre-ACA where caps were in a different realm. Caps were like how much you could spend you were limited per your lifetime and annually from even using your benefits. So definite movement forward, but there is room for improvement.
Yeah, and I'm glad you highlighted that, because I think when you start to talk about healthcare, especially in the United States, you stumble upon rather quickly opportunities for further discussion, right? Like nobody looks at our system and says, "Oh, this is perfect." And there are things where it's, there's nuance to discuss and nuance to dive into further, and we're constantly looking at it. What is in that preventative healthcare bucket, and how do we make sure it's comprehensive and that it's accurate and we, are getting that right. But also I think it's easy, especially now, because this is, we're about a decade or so in to actually appreciating and using the ACA. It's easy to forget how far we came. In the Medicaid space, we used to not be able to cover adults if they didn't have a dependent child. Mm-hmm. And so that's hundreds and hundreds of thousands of people in Illinois that got coverage. And so that was a big gap on the Medicaid side. And then on the commercial side, like you said, the structure was just completely different. I mean, it's almost like it's hard to even try to think back to pre-ACA coverage and what that would mean. And then also, like you highlighted, Laura, on the Medicaid space, we always think state officials, elected officials, senators and representatives, they matter. They determine the benefit. On the commercial side, it's just a very small snippet of what they can impact. It's really not only your congressman, my congresswoman, but all 50 states are really impacting the federal insurance regulation, and that's truly impacting the bulk of in commercially covered folks.
Right. Yeah, and I just absolutely right. And just to kind of flesh out to my earlier point, I think ACA we have come a long way in, a little over a decade with, how people can access coverage and that important front door and getting them to, into the healthcare system affordably. But when I say affordably, I also mean, unfortunately, we're still at a time 10, 11, going on 12 years now, where healthcare costs are still increasing substantially and absorb a significant amount of our GDP as a country. And, we again could talk about this for hours and hours upon end. And that is a barrier, not just, with respect to preventive ongoing management of your chronic condition if you have them, but just the barrier of cost, healthcare costs, because insurance, is a reflection of the costs borne out in the system. Certainly on the private market side, what you pay in your premium and your out-of-pocket is, it's set on the out-of-pocket side, but your premium is definitely going to be a reflection of just the cost of providing healthcare, and it's unfortunately not going down.
Yeah, I'm so glad you said that, because there's been a lot of discussion about the cost of healthcare. And I think we talk a lot about premiums and copays. And that's like a very important piece of the puzzle. But if you don't also talk about, what is that premium paying for, and what is the cost, and how are those costs set? then you're just looking at one piece of the puzzle, and you're only going to be able to impact so much. And so one barrier that we're all collectively working on, and we've made great strides on, to preventative healthcare, is decreasing that cost. Removing those barriers. A lot of areas where there's no cost for preventative, for what we would all consider preventative healthcare. More work to still be done. But then we had a pandemic. And so we're making progress on preventative healthcare, and here comes COVID-19. And we have just been, just hit hard on the preventative healthcare side. So if you were lucky enough to not be personally impacted by the pandemic in terms of loss or illness, you were impacted indirectly in a myriad of ways, obviously, socially, emotionally, financially, but also often on the healthcare side. And so can you talk a little bit, like, I know what we saw on the Medicaid side, but what did you guys see on the commercial side with regards to how COVID impacted preventative healthcare?
Yeah, so certainly it had a devastating impact just on many people, directly and indirectly. With the private market space, unfortunately, there was job loss, and individuals that had insurance through their employer lost that coverage. There was attempts, obviously, to open up the marketplace and provide some special enrollment periods so people can try to get an alternative coverage. There's the COBRA piece to extend from your employer, but unfortunately, there were just pure gaps in people having health insurance one day and then not, and maybe being qualified technically for Medicaid or other types of coverage options, but not signing up. So that certainly we saw that piece of it play out. But I think also for those that did continue to have membership in a health insurance plan, the very fact that you couldn't go to your providers for some period of time, or you were certainly recommended or encouraged not to access the healthcare system for services that were not related to COVID or emergent, which would include going, maybe if you had a scheduled annual checkup, which I was in that bucket. I think many people were, you either rescheduled or put it off, and unfortunately many people put it off, including screenings. And there was a significant drop, and I think there was some data put out by the CDC not that long ago that also it mirrors a little bit on what happened on the private market side, where you did see people drop off on going for their screenings, their breast cancer screenings, their colon cancer screenings, all those important screenings that matter and could delay otherwise finding some problems down the road. But certainly when you look at it, stand back a little more from what the data showed, not just with the private market, there was huge inequities in those that didn't go for the screenings. In fact, I think there was well over 80, close to 90% drop off. I think in women and men, both of that were either low income or underinsured, or those of color. And it definitely that is something it started to come back a little bit as the system has gotten back to some normalcy, I guess, if the best way to put it, or the new normal. But that's definitely not a new challenge, but an enhanced challenge that we all kind of collectively have to figure out how to address, because it's certainly from the health insurance, private health insurance side, you may have seen that there's lots of stories about, they didn't accrue as many costs in the pandemic. Well, that's true. Fortunately, with respect to those that were accessing the healthcare system, but the underlying story of that is that all those people that were, if they were unfortunately not dealing with COVID, and that was a terrible stress on our system, but the costs that come from delay of care, delay of preventative care, fortunately, I hope that this proves me wrong, but I think we'll be seeing that borne out in certainly a little bit this year, next year, and the foreseeable future. So we do have to address that.
Yes. And we saw, I mean, the same things, and we're seeing it this year already within the Medicaid program. So first, we had the opposite. Our membership grew significantly because, as you said, Laura, people lost their jobs and they ended up on Medicaid for the first time. And really, and a lot didn't. Our number one in Illinois, the largest portion of uninsured members of our population are actually people eligible for Medicaid, not enrolled. So when we talk about how do we increase access, there's a bucket who are eligible, a large bucket of people who just don't realize they're eligible and haven't enrolled in Medicaid. And so that would be the number one way to decrease, the uninsured, is to get people signed up for the benefits that they're already eligible for. But so we saw a bunch of people move into the Medicaid program and realize that the Medicaid program was a healthcare safety net for the first time, which I think my hope is going forward that more people will appreciate the value of the program. But what we also saw was that delay in accessing preventative care, because it either wasn't available for a period of time where you just really couldn't get in, or at least, I mean, I'm still seeing this, it's harder to get in. They are taking more protocols, safety protocols, and limiting appointments and having more time in between appointments, all of which is great, except that naturally means that there are fewer appointment slots. And so it's harder. If you are still employed, you've seen how many friends and family become unemployed. And so you don't want to take any extra time off. And you're nervous, and there's just so many factors. So there's just that piece as well. And exactly what you're saying, Laura, is it's not only that direct impact, right? Like, oh, you didn't get your mammogram in 2020, you'll get it in 2021, and everything will be fine. That is absolutely the case for some people. For others, they didn't get their mammogram in 2020. It was a missed early diagnosis of breast cancer. It'll hopefully be diagnosed in 21, maybe 22, but the cancer's progressed. And so the treatment is more complex. It's more involved. It's more costly. It's more burdensome for the member, and potentially a worse outcome. And so we are going to see that borne out. I think for years to come, especially with preventative cancer screenings. I also, we saw a huge drop in vaccinations, and to your point of the disparity that we always knew existed, but really the gap widened during this time, is that while we've seen the numbers for adolescent vaccinations come back up for commercially insured members, we don't see that same rebound for our Medicaid members. And so we're worried about that, especially because we've got, which I just want to underscore all of the time, we've got a vaccine for cancer, with the HPV vaccination. And that's at the adolescent range. And so if our low income adolescents aren't getting this vaccine, they're not getting back in, they're not getting vaccinated, that's going to impact them, short term, but potentially long term as well. And so we've got to collectively work as an ecosystem, all healthcare providers and plans, on how do we close some of these gaps, and what do we need from a public policy perspective, but maybe what do we just need from messaging and outreach and using the tools we already have. And I think to that end, it sort of gets me to my last question, because we talked a lot about already, sort of the challenges, but what are we doing and what can we do in collaboration with providers and collaboration with one another, to increase access to preventative care, and really at the end of the day, improve outcomes, which is why I know I'm in this business and I know you're in this business, is to directly and positively impact people's lives.
Yeah. So I think there are definitely some ways that the health plans are on the private market space are thinking about how to kind of approach this problem, and a lot of that's sort of under the I would say under the radar, but not certainly visible maybe to everyone, but it's in the relationship and specifically the contractual relationship they have with the providers. So it's kind of known as the value-based contracting, or the shared savings model, which is designed, with providers and payers to try to, use financial tools to incentivize care outcomes. So identifying patients that, are high risk or in need of medical management, and how do you work within the pool of money that you have to try to improve outcomes and hopefully promote cost savings and more money for the providers and certainly more monies for the consumers in their pockets. That's kind of a one way. I mentioned earlier about, large employers particularly working and partnering with health plans, especially those that self-insure or take the risk on. They have a lot more, it's not an inexpensive endeavor for them to do that, but they have levers to pull within their population of employees to encourage wellness, and a big part of, recruitment and what it means to keep employees engaged and at work and productive. And, there's things such as integrated health benefits, for example, pulling in the pharmacy, the medical, and the behavioral, and trying to identify, at-risk employees and connecting with like health coaches and working through if I use this example, if you're diabetic, but maybe you're suffering depression at the same time, can this additional health coach kind of identify areas in which services and different providers, are needed gaps in services that are necessary to maintain your good health. And the patient, it's hard. It's always trying to figure out how to motivate the patients, and it's difficult. I mean, I think it's about keeping the healthy and the less healthy in good health and good outcomes. I think it's hard. I'm not saying it's an easy thing to do, but those are just a couple of things. We talked about COVID vaccinations and immunizations, just information, just trying to identify those within, there's initiatives going on now about within the private and the public space of what members need vaccinations, how can we encourage them to go get it. Certainly can't require them to do that, but we can use all information, dispel any rumors that it's any cost to them, and remove those concerns. But those are kind of a few ways. Telehealth, I would be remiss if I didn't mention telehealth. That's a big part of it. Not that you can do a screening via telehealth, and certainly like a mammogram, certain screenings you can do, but the accessibility to your providers has also changed, and particularly within the behavioral health space. I would say that there's been, I think, an uptick in individuals accessing providers via telehealth, particularly as we've seen on the commercial side. Saw that a lot during the pandemic, but where those telehealth claims have kind of dropped off for other areas, it hasn't necessarily dropped off as significantly for behavioral health. So that is, I think, the technology aspect of encouraging consumers to interface with their providers, maybe not necessarily in person. That has a lot of promise, and I think there are definitely ways in which all providers and health plans are trying to think about creatively how to incentivize consumers to continue to seek those types of important services.
Oh, no, I was going to say I could not agree more. Laura, I'm so glad you wove telehealth in there because it's so critical and obviously really a piece that changed significantly over the past 2 years.
Yeah, for sure.
So that was a really just fantastic conversation. And as you both talked about on some of the topics, some of this could have gone on for hours, but unfortunately, we're going to have to cut it there. So again, Laura, thank you very much for being here. We would really appreciate if you wouldn't mind coming back and speaking with Sam on this and then other topics in the future episode of Sam Says, if you don't mind.
Oh, of course, I'd be happy to. In fact, I think maybe Sam and I could just record our conversation. So we tend to talk about this all a lot on podcasts, off podcasts. So no, it's been a pleasure. I always enjoy talking to Sam and to all of you. So appreciate it.
All right. Well, we greatly appreciate it. Sam, before we close out, very robust discussion today. Is there anything that stuck with you or you'd like to dive into further at a later date?
So I always love talking to Laura about healthcare finance. As a economics major, it's sort of one of my nerdy passions. But one thing I think I'd be remiss if I didn't just underscore is that preventative care and vaccinations, whether they be immunizations for things like HPV or the flu or shingles or COVID, are free to all members. If you have commercial insurance, if you have Medicaid, the COVID vaccine is free. And if you're uninsured, the COVID vaccine is free. So please get vaccinated.
Very good point. Again, great episode today. And if you like what you've heard, I encourage you to visit the I'm Hip website at imhip.net. That's IAMHP.net to learn more about what I'm Hip is doing and to listen to other interesting podcasts like this one today. I also would encourage you to like and follow us on social media on Facebook, LinkedIn, and Twitter. And if you're interested in becoming a trusted partner, I encourage you to reach out to I'm Hip's Chief Operating Officer, Elena Kennedy, or visit the website at imhip.net. On behalf of Sam and the team at I'm Hip, again, I'm DeRondo Beverly with the Gemini Group. Thank you for tuning in to another episode of Sam Says. Stay safe, and we'll talk to you soon.